Imagine waking up to the sound of gunfire in a place you thought was a sanctuary. That's the reality for Palestinians in the West Bank. In the early hours of a Tuesday morning, a hospital in the town of JENIN, known as the Ibn Sina Hospital, was transformed into a battlefield. Israeli forces, not in their usual military attire but disguised as civilian women and medical workers, stormed the hospital. Their mission was not to save lives but to take them. 3 Palestinian militants found themselves on the receiving end of this dramatic raid. The Palestinian Health Ministry didn't take this incident lightly. They condemned the raid, calling it an assault on a place meant for healing. They further urged the international community to pressure Israel's military to halt such operations in hospitals. Can you imagine the fear and confusion of patients hearing gunshots instead of the usual hospital sounds? The Israeli military defended their actions. According to them, the militants were using the hospital as a hideout. They even suggested that these individuals were planning an attack. However, they did not provide any evidence to support these allegations. It's a classic case of he said, she said. The footage from the hospital's security camera made its way to social media. It showed about a dozen undercover forces. Some were dressed as women with Muslim headscarves, others as hospital staff in scrubs or white doctor's coats. One even had a surgical mask on, a rifle in one arm, and a folded wheelchair in the other. This incident raises questions about the ethics of warfare and the use of hospitals as battlegrounds. The ripple effect of this incident is far-reaching, with implications that extend beyond the immediate event. As we delve into the wider context, we're drawn into the ongoing strife in the Gaza Strip, where talks of a ceasefire hang precariously in the balance. This discord is rooted in a Hamas-led assault on Israel, an event which sparked a fierce response from the latter. The Israeli retaliation resulted in a staggering number of casualties, which only served to fuel the flame of this already volatile situation. The conflict in the Gaza Strip has resulted in a humanitarian crisis that is hard to ignore. A significant portion of the population, around 85%, have been displaced, with a quarter of the residents teetering on the brink of starvation. The tiny coastal enclave has been leveled, its infrastructure in ruins, and its people in desperate need of help. However, aid to this beleaguered area has been compromised. Funding to the primary aid provider to Palestinians in Gaza has been frozen. This freezing of funds came in the wake of allegations that a dozen workers had participated in the assault on October 7. These allegations, if proven, could have far-reaching consequences, potentially worsening the humanitarian crisis in the region. The situation is further complicated by the fact that the conflict has not only impacted the physical landscape and the people, but also the healthcare system in Gaza. Already frail before the war, it now stands on the brink of collapse, overwhelmed by the number of patients and the scarcity of resources, all due to restrictions and repeated interruptions from the ongoing conflict. In the midst of all this, one thing is clear. The situation in Gaza is complex and volatile, with no clear end in sight. The implications of the undercover raid in the West Bank, the ongoing fighting in the Gaza Strip, the humanitarian crisis, and the freezing of aid all intertwine to create a scenario that is as precarious as it is complicated. These events have created a complex and volatile situation with no clear end in sight. Hospitals, the very places meant to heal and protect, have become targets in this conflict. The Israeli forces have been under heavy criticism for their raids on hospitals in Gaza. These healthcare facilities are already under immense pressure, teetering on the brink of collapse due to the war, a severe lack of necessary resources, and repeated interruptions from fighting in and around the facilities. Gaza's healthcare system, which was already fragile before the war, has been subjected to a crushing burden of patients, an acute shortage of fuel, and a lack of medical necessities, all of which are exacerbated by Israeli restrictions. The situation is so dire that even the most essential healthcare services are being compromised. Israel, however, maintains that these hospitals are not merely places of healing but are also being used as strategic cover by militants. The militants are allegedly hiding out in these hospitals or even launching operations from them. The Israeli military claims to have found underground tunnels in the vicinity of these hospitals, and even weapons and vehicles used in attacks on the hospital grounds. In a world where even hospitals are no longer safe, one can only wonder, where does the line of warfare end? The West Bank raid is a stark reminder of the complexities of the Israeli-Palestinian conflict. We've delved into the details of this undercover operation, dissected the ongoing strife in Gaza, and explored the implications of this enduring conflict. We've also shed light on the disturbing trend of hospitals being targeted in the heat of battle. These elements combined paint a picture of a region embroiled in a volatile and seemingly unending cycle of violence. As we ponder on these realities, we must question, how can peace be achieved in such a volatile environment?